And we're going to do burned hand. And burned hand's a little bit different. It depends on what part of the hand is burned, whether or not the fingers are involved. I may or may not be able to do CMS with a burned hand. If the fingers are not involved, I certainly can. My first priority, though, will be sure that the burn is adequately cool. And if you've burnt yourself at home, you know, you run your finger under the faucet, you take it out, you dry it off, and you go, ooh, it still hurts. And you stick it back under the faucet and cool it a little bit longer. If it was a large surface area burn, we have to cool the burn to stop the burning process. We have to stop the burning process and cool it. But then if it's a large surface area, we have to be sure that we don't overcool and start to cause the patient hypothermia issues. If it's an isolated burn like the hand, we need to cool it. It's probably going to take 10, 15, maybe 20 minutes to adequately cool it before it helps to control the pain. You know, if it's a minor burn, most of us don't go to the doctor. If it's a significant burn, you may end up at the doctor or at the emergency room. So if the fingers are not involved and it's the hand, I can't check radial pulse necessarily because it's the hand and the radial pulse is not distal. So then I would need to come in, and if they're not involved, I could check cap refill. I generally check the thumb and the pinky finger, so I'm getting radial ulnar nerve, and I can say, did you feel that?
Yes.
Can you feel that?
Yes.
Does it feel the same?
Yes.
Very gently wiggle your fingers. Okay. If the fingers are involved, I of course cannot do that. It's important to understand that if the burn is serious enough where fingers are stuck together, I never do anything to separate those fingers because you'll literally pull tissue right off the fingers if you do that. So if it involves the fingers, I'm going to come in once I have it adequately cooled. And I'm still going to use dry dressings in this case simply because you cannot, in our situation, if we're out helping and we're camping with friends, I have no way of having sterile moist dressings, so in this case I would use dry dressings. And I would fold this so that I could slip it between the fingers that are not stuck together because I don't want to bandage them and get them stuck together. So I can come in here and handle stuff by the edge, and I could slip this into place. If the burn's on the top of the hand, I would come in and use dressings to cover that burned area. I could add dressings in between the thumb if the thumb and hand was involved. I have no bleeding to have to control, and what's going to happen, I've got this all in place. I've checked CMS if I can, and this is one time that you're actually going to start wrapping proximal to the injury. So I can come in here and start at the wrist. And as you've seen in all the clips, I unroll against the skin. I don't flip it over where I have to pull it away from the skin. And when I start to bandage here, I'm not bandaging to control bleeding. In fact, I'm bandaging if I have any distance that this patient has to go before they get help, and if you can't have them to the doctor somewhere within just a very short period of time, we cover a burn because if it's especially first degree, second and third, second degree, deep second degrees are so extremely painful that air blowing across a burn will actually increase the pain level. So what we're really doing is bandaging to reduce risk of further contamination. I'm not covering her thumb if her thumb's not involved. If it is, I would bring it down at this point and then bandage over the top of it. I could come in between the fingers to cover that. We're going to leave your thumb out though this time. Okay. I think I'll take a twist just to snug things up here a little bit. So we're bandaging to reduce risk of further contamination and to help in pain control. So I started proximal, I come back up. I'm going to bring this down. I'm going to gently start tucking it in. Make sure it never comes in contact with the dressings. And if the fingers and thumbs are completely involved, they would be completely covered. I could still you know, if the fingertips were not involved, even through the bandages, I could come in, ask if she could feel that, ask if she could feel that, if it felt the same. And even if her fingers were completely covered, I could still check motion, and I could squeeze fingers or toes through a bandage or even through a pair of shoes if it's on the foot, to see if I can get sensation and motor function. If the thumb, fingers, toes are completely covered, I can't check distal circulation.